we would try our best to talk to people about jobs when we'd got the time, or we knew the person, or they were receptive to that. But we're not the experts in that, and so sometimes we can fall into the trap of giving advice that may not be the best advice or the right advice. So WorkWell helps by forming that bridge to enable people to talk to someone who's an expert, a work coach, who can really work with them to look at what it is that's a barrier. So are there things their employer needs to change?
It's easy to give out sick notes, but the sick note's no cure for anybody. So there needs to be something in between. Now, GP appointments are 10 minutes. They're relatively limited in terms of what we can offer for patients who are not able to go into work. And sometimes it just needs more time and more attention. We know where the patients are. WorkWell obviously has a service to offer, but often our patients don't know it exists, and they don't know it's for them, and they don't know it's something that they would be able to benefit from. So I think our role as the surgery was trying to bring the two together.
Participants, our patients, are struggling a lot with mental health problems, a lot with back pain, with a variety of other joint pains, stress and anxiety, as well as short-term conditions.
And so they would be offered either a telephone appointment or a face-to-face appointment with someone from WorkWell. And then the WorkWell staff would then speak to that patient around what sort of opportunities they could offer the patient, what sort of support they were able to offer.
So being in employment is about much more than just getting a pay packet at the end of every week or month. It's about providing structure to your day, a sense of purpose and connection with other people, all of which are really important to maintaining both your physical and your mental health and well-being. So by working together in partnership with WorkWell, we are able to support people with all of the barriers that they face that stop them from being able to either get into employment, returning to employment, or staying in their current role. We've had some fantastic results through taking this approach so far, much more so than just relying on medication alone. We've dealt with patients who have not wanted to leave their house at all because of their mental health concerns and worries. But by the end of working with social prescribing and WorkWell together, they've got to the point where they're going out, they're taking part in regular exercise groups, and they're going to walking groups, they're doing gardening groups. But also that's increased their confidence so much that they now feel ready to volunteer. So they've taken up a volunteering role with Warwickshire Wildlife Trust. And their ultimate aim now is to move on and find employment within that area. So we've gone from 8 months ago being someone who couldn't leave their home to now actively searching for that role. So that shows the amazing work that can be achieved by working together with WorkWell and the social prescribing team.